Cindy, thank you so much for that really wonderful introduction that I wrote. Let me just start to make sure I'm in the right place. Has anybody here ever had a less than fully satisfactory visit to a physician's office? You have? Oh, okay, good. Well, then I picked a decent topic to discuss. We'll spend our time talking about that. We've left the science of Morgellons behind us now, and at least for the next little bit, we're going to talk about, how to have a more satisfying visit, a better experience with your doctor. Left and right. Great. And now, my conflicts. If this were a talk on psoriasis and I were mentioning the names of products, then I would be telling you that it is safe to assume that I took money from the companies that made those products. But since I'm not talking about psoriasis, I didn't list all those many companies here. Instead, I'm going to show you some data from a doctor rating website that I started. I'm the author of a book about how people in different groups get weird ideas about each other, and a book on how to make your visit with your doctor better. Mostly I talk to doctors. Mostly I talk to doctors about psoriasis and what they have to do to help to make these patient visits better. When I talk to them, I only talk to them about things that they control. I don't talk to them about trying to change the patient because all they can control is themselves. And so when I talk to you, I'm not going to talk to you about things that doctors should do to make there be a better visit, because you can't control what the doctor does. You can only control yourself. And so that's what I'm going to focus on. I spend so much time thinking about what I and what other doctors can do to make visits better. I will present some of that information, but only as a way of illustrating principles that apply to all of us. So the things I want to discuss, certainly trust is going to affect patients' outcomes. Patients who don't trust their doctors, don't take the doctor's medications. Doctors who don't trust patients, don't listen to what the patients are saying. And so establishing trust and communication is certainly probably the number one most central foundational thing that we're going to be talking about. The idea that it's probably better to stick with one doctor than to, have failures at 27 doctors. You're better off, I think, just seeing the one and letting that evolve over time rather than switching from one to the next, because one to the next, generally speaking, it's just going to be the same problems over and over again. There's no opportunity for a meeting of the minds over time. And I'm not going to talk too much about theory because it's all basic practical advice. Now, the advice I have comes from the lens through which I look at the world, which is the lens of psoriasis, which is another really, really bad disease, okay? Morgellons is bad. It's horrible, but bad psoriasis, the kind of psoriasis patients who are sent to me, that's a horrible disease too. And these people desperately want and need a well-informed, caring doctor. So hopefully some of the things I've learned from the psoriasis world will be applicable here as well. The people with psoriasis have their own national foundation. The National Psoriasis Foundation is probably the single biggest patient advocacy group in the world of dermatology. They're like the 300-pound gorilla of patient organizations in my world of dermatology. They help my patients so much. They help educate patients about all their treatment options, help them deal with the various social situations they may find themselves in. Terrific organization. And they did all this work to make sure that there were good treatments available, to educate doctors about those treatments. And every day, they would get calls from patients who were frustrated and couldn't find a good doctor. Does that resonate with anybody here? It does? Oh, okay, good. So we have the really good treatments nowadays for psoriasis, but they don't always work. And I study that. And one day I'm walking down the hall with one of my research partners, and he was mentioning to me that there was a company in California that made some funny-looking medicine bottles that were originally designed to help find out whether people taking AIDS drugs were taking the medication, because it was really complicated to take medication 5 times a day in the early AIDS treatment period. These funny medicine bottles contain computer chips that record the day and time patients open and close the containers, you know? So as soon as I heard this, I turned to my minions and I said, I don't care what they cost. I have to find out what my psoriasis patients are doing. So we did a little study. We were doing a study. We gave people some cream to put on their psoriasis. We told patients, put the medicine on twice a day. We're going to monitor your use of it. So fill out this daily diary and bring the bottles back for us to weigh. So you can see we were totally honest. We told them we were monitoring them. We didn't mention the computer chips. Now, I don't know if I should be telling you that doctors can be deceitful. Maybe that's not the message I'm trying to get across, but I am deceitful at times. So here's a diary from one of the patients in the study. You could see this patient's particularly obsessive compulsive. They record when they put the medicine on to the nearest 5 minutes. If they took an Advil or a Tums, they wrote that in too. According to the computer chips, they put the medicine on pretty much twice a day, just like we had asked them to in the study. Here's another diary from the study. This one doesn't look like it's quite as obsessively compulsively filled out. Looks like they've usually filled it out to the nearest hour. One of the interesting things about this diary is that they seem to use the same pen every day for an entire month. Here's what they did according to their computer chips. Here were the first 10 patients we studied. Orange is what they said they did. Yellow is what they actually did. You see a wide range of behavior in what people do with medications. I think there's a lot of room for, mostly, again, I talk to doctors about this because I hold the doctors responsible for the patients not using the medication. The doctors are not doing what they need to do for the patient to trust the doctor enough to use the medication, to educate them properly about the use of the medication, or whatever you need to do to get people to use the medicine, patients aren't doing. And I don't blame the patient, I blame us, because we can only control what we do. Patients come to us with different characteristics, different diseases. Based on what I've seen today, I don't think Morgellons is a single entity. There's one word, Morgellons, it's a label, but some people have something and some people have something else. So there's a range of things that come to us, and my goal is to get people well, and it's going to depend on the patient, it's going to depend on their disease, it's going to depend on their treatment, it's going to depend on their interaction with me and how well I'm able to get them to use the medication. So, as Cindy said, I've trained MD, PhD, biochemist, physicians. My father-in-law liked to say, my son-in-law, the physician scientist. Then he found out I was going to be a dermatologist. He was like, I can't tell my friends that. Can you come up with another name for it? Well, I'm going to do a dermatopathology fellowship. He's like, oh, dermatopathologist, I can tell them that. So, but that's why I got into medicine, not because I'm an empathetic, naturally, good at parties kind of person. I'm naturally really good at taking standardized tests. Okay, that's how I got into medicine. That's how I got into dermatology. Okay, you don't want to have me at a party unless you have a lesion you want me to look at. All right. So I got into psoriasis. Now I could tell psoriasis from across the room. Now you probably are already thinking across the room. Yeah, I know that kind of doctor. And so I could throw the door open, walk into the room, see the psoriasis from across the room, start writing the prescription as I'm walking towards the patient, giving them the prescription knowing that they had psoriasis, that this was the medicine they need, and leave grabbing my suspenders going, I'm a great doctor. I made the right diagnosis, and I prescribed the right therapy. And then my patients, the medical center started collecting patient satisfaction survey, and some patients said, I really like Dr. Feldman, and some said, I wouldn't send my dog to that uncaring jerk. And that is not exactly, jerk was not exactly the word they used. Now, when I saw that, my first thought was, they have me confused with my partner, Dr. Fleischer. And then I realized, no, wait a minute. They don't know that I can tell psoriasis from across the room. I left them with the sense that I'm an uncaring jerk. I got a lot of feedback from patients. What was the most helpful feedback I got? All the people who said, oh, he's a 10 out of 10, he's great. Did that help me? No, that didn't help me at all. Hearing that they thought I was an uncaring jerk changed my life. And I thought, this is really very helpful to get feedback from patients. I thought, the way our medical center is doing it, it's really complicated. It's a mess. Let's do it online. I'm going to start a doctor rating website. Let everybody rate their doctors online. You know, tell us, how was your visit? And tell us what was good about it and what could have been better. My doctor rating site is different from some of the other ones out there. This one's designed by a doctor. So these open comments that people make would only go to the doctor. They're not made public, for better or worse. That's a doctor's perspective on this sort of thing. The survey would ask other questions like how friendly the caring the doctor was, how thorough the exam was, and all the usual stuff. And it would ask if there were any problem areas. If there was a problem identified in any of these areas, it would drill down, get additional detail. Now, every now and then I'm going to look at my watch to make sure, for your benefit, that I stay on time. I have until practically forever, because we have question and answer after this, right? If I go on and on, it doesn't really matter, right? But I don't want to eat into the question and answer time. Officially, what time am I done? 3:45. Okay, great. By the way, I'm telling you why I'm looking at my watch, because one of the things I teach doctors is never look at your watch when you're with a patient. I don't know if you remember when the first George Bush lost the election to Bill Clinton. It was because during a national debate between he and Bill Clinton and Perot, George Bush looked at his watch, and when he did, the American people said, he seems to be in a hurry to get out of here. He doesn't care about us. So you don't want to do that. What I tell the doctors is, you want to put a clock on the wall so that when you're looking at the clock, the patient thinks you're looking at them in the eye. All right? All right. It's cold. It's deceptive. That's who I am. Okay. So here's what my patients thought of me after 16 ratings. 9.7. That's not representative of me, because by the time I had 500 ratings, I dropped to a 9.1. But my mom looks at my 9.1 and she goes, "Ay, my son, the doctor, his patients love him." 9.1 is pretty good, right? 9.1 puts me solidly in the bottom third of doctors. Okay? Yeah, I don't put the percentile scores on, because then my mom would know I'm in the bottom third of doctors. Here's another dermatologist, Dr. Santmeyer Rosenberger. She's done awesome, 150 ratings. She's not quite a perfect 10, but she's awfully close. And then if you look online at what people say about doctors, you might find something like this. I'll leave this up. I won't read the whole thing to you. I'll probably talk while you look this over. This is the kind of thing that might be posted on the web about a doctor. Well, I don't know. This doesn't sound like anything you've experienced, does it? They would not help me when I complained. Narcissistic jerk with attitude. You haven't seen anybody like that, have you? You have? Oh, sorry. All right. Well, this is a bad doctor, right? Well, let me ask, is this a bad doctor? It does seem that way. Now, hopefully at the end of this talk, I'll convince you this guy's a really good doctor who just had one bad interaction with a patient that we can totally blame the doctor for, but this is not representative of this doctor's practice. If you look at what people say about their dermatologists, again, I'm a dermatologist, they say stuff like, the average scores pretty high. It's mostly here you got 9s and 10s, right? 9s and mostly 10s. Mostly the patients say their doctor's great, but then some of the visits, the dermatologist got a 0 or 1. And my practice is not that different from that. Most of the scores that I get are 9s and 10s, but then some people really did not like the experience they had with me. And that's my fault. I should be doing better than that. I shouldn't have anybody feel this way about me. I don't think any dermatologist wants anybody feeling that way about them. Their goal is this. If you looked at overall, you know, at 7,500 responses about dermatologists, the overall satisfaction rate is 9.5. It was 9.6 for return patients, 9.1 for new patients. Why is that? Why is it higher for return patients than for new patients? I'm sorry? Trust, yeah. If you liked the doctor, you go back. So if you're looking at return patients, you know that they like the doctor. They keep going back. The patients who are new, you're selecting for ones who haven't. Well, I'm sorry. The return visits select for the happy patients. The new visit. Now, this is an online survey. Who fills out online surveys? Happy people or unhappy people? Unhappy people. So this is actually, I believe, an underrepresentation of how good doctors are doing, because overall we're selecting for the unhappy patients, and doctors are still over 9 out of 10 on average. Okay? So keep that in mind. The unhappy people are probably more likely to go to my website and fill out the ratings. What did patients say about some of those general areas? Generally speaking, patients found the doctors friendly, thorough. Hard to believe that generally speaking, patients found the dermatologist to be friendly and thorough. I'm quite sure that most people, probably that wasn't their experience. But that's what the data show. And the question is, who are the bad doctors? So I looked at the doctors who have 20 or more ratings, okay? This counts for over 15,000 visits. The average score of a doctor is 9.3, and the lowest score was 7.8. None of the doctors had scores of anywhere near 0 or 1. Lots of doctors have scores of 0 or 1 from individual patients. None of the doctors had an average score from all their patients of 0 or 1. Almost everybody, all these doctors, their patients loved them in general, although there were individual patients where that doctor did not satisfy the patient. Is that really clear? I don't believe there are any bad doctors, okay? I could be wrong, but I have never met one. Everybody in my medical school class was awesome. By the way, do you know what they call the one who graduated last in my medical school class? Doctor, exactly right. But they were all really great folks. All of them were really super bright, caring individuals. Everybody I've met in my department is super great. Now, I will say that there are some dermatologists in my community, and I've seen some of their patients, and I don't think I've seen a single one who is happy with the results. All right? That is true. In fact, generally speaking, I can tell you, when I see patients refer from the family doctors, oh my God, they send me people with the wrong diagnosis, the wrong treatments that made things worse. I can count on one hand the number of times I saw a patient for a rash that the family doctors managed to cure. Do y'all know why this is? Well, it's because every time they make the right diagnosis and prescribe the right therapy and the patient gets well, they don't send me the patient. I only see their failures. Same thing with the dermatologists in the community. All their happy patients stay in their office. I never see any of their happy patients. So even doctors think there's some bad doctors out there. I don't believe there's any bad doctors out there. Now, I told you the National Psoriasis Foundation was getting call after call from patients, right, saying that we can't find a good dermatologist. And the Psoriasis Foundation was so upset about this, they decided to do a survey. And they surveyed patients, and they found that the patients were happy with their dermatologist. And they scratched their heads, that's not right. Then they did a better survey, a representative survey. They got a bunch of survey experts. They did a really well-designed survey, and they found that the patients love their dermatologists. And then they realize, you know what? All the patients who love their dermatologists aren't calling us to say, we love our dermatologist. We're only getting the calls from the unhappy patients. And you may get one every day, and each one of them is too many. But out of the 6 million people in America who have psoriasis, if you get a call, if you get 2 calls a day, that would be roughly 600. Out of 1 million, that's 1 in 10,000. That could mean that 9,999 out of 10,000 were happy with their dermatologist, but you're only selecting for the one. This is a phenomenal bias. I like to teach my students about this. It's part of my world peace effort because, you know, my parents, they read the newspapers. They think they know the world from the newspapers. The newspapers print what's new and different and not what's normal and everyday. If you read a story about doctors on the cover of the newspaper, it's probably going to be something like a pediatrician who raped a child or something. Pediatricians are not raping child left. I'm Jewish, all right? Do I know what Catholic priests are like from reading the newspapers about Catholic priests? I don't think so. I really don't. You know, I talk to dermatologists about tanning beds. Tanning beds are great treatment for psoriasis. These dermatologists think they never work. Why? Well, because if they have light box in their office to treat psoriasis, if they put 10 people in their light box, 8 clear. If they see 10 people who tried a tanning bed, how many of them would be clear if the tanning bed is just as effective? No. Good thought. That's what most of my students say. But if they see 10 people who tried a tanning bed for psoriasis, it would be 10 who didn't clear. All the ones who cleared wouldn't come to the dermatologist. You know, even though we just talked about it, you didn't think about that because it's not natural for us to think about what we don't see. We're always looking at what we see. You have a visit with a dermatologist and it doesn't go well. There's no question it didn't go well, but you didn't see all the other visits where other people had a good time. And so these doctors who seem like they're bad doctors who are uncaring, they're probably almost certainly caring, really good doctors, and your interaction with them was not good that day. Don't necessarily give up on them. You may find that by working with them over time, you'll have a better experience with them. Now, from the online ratings, I could see what patients liked about their doctors. You know, these were things that they said they liked. Normally, they don't say, I really liked my doctor because he made the right diagnosis and prescribed the right therapy. They almost never say that. They always say, oh, he was caring and friendly. Things they say they didn't like was that he didn't, disinterested in my health, poor listening, poor communication. I think if I, pulled people here, lack of thoroughness of examination would have been really high up on the list of things. When we looked at the things that determined patient satisfaction that we could find in our data, the age of the patient, whether it was a first visit or not, didn't matter much. Gender didn't matter to satisfaction. How long the doctor kept the patient waiting mattered statistically, but it accounted for only a tiny fraction of what patients felt. And how much time the doctor spent with the patient was statistically significant, but it really didn't matter much to what patients said about their doctors. What mattered almost completely was the doctor's friendly, caring attitude. If the doctor kept the patient waiting an hour and spent 2 minutes with the patient, but somehow in that period managed to communicate to the patient that he or she was a caring doctor, which is really hard to do after you've disrespected people by keeping them waiting and not spending any time with them, those doctors still got a high score because people want a caring doctor. So what I teach doctors is, listen, I know you spent, 12 years in training. I know you're doing CME. I know you care about every one of your patients. That doesn't matter. What matters to them is that you make sure they realize that you care about them. And that is fundamental, okay? And that what I want to get across is that is fundamental both ways. So if you want to have a good relationship with the doctor, just like you would want them to be caring, you want to make sure that you come off to them as being friendly and caring and respectful. Because if you do that to them, it's going to be the same to them as it is to you when you feel like you're seeing somebody who cares about you, is friendly and respectful. The most important factors to patient satisfaction in this study were explanations, respect, concern about the care, and the friendliness. Okay? And so if those are what matters most to patients, you can bet that we're all human, and those are the things that matter most to doctors. All right? So I'm pretty much who I am. Okay? Maybe sometimes I don't do as good a job communicating that I'm caring. Sometimes, you know, the test tube research scientist does really well on standardized test kind of Feldman comes out, and I interact with patients who I care about in a cold, apparently uncaring way, even though I desperately care about all my patients. And so you can understand why some of my patients rate me a 10, and sometimes they rate me a 1. I'm the same person. Sometimes I leave patients feeling I was good, and sometimes I leave them feeling that I was bad. I'm not the best doctor out there based on the average of my scores, but I'm not horrible. But to these folks thought I was really bad. Why is it that some of the patients thought I was really good, and why is it that some of them thought I was really bad? Part of it is certainly me. Part of it is the context that people bring to something. Humans do not measure the absolute reality of things. Humans measure things in context. It's just the way the brain works. I don't talk about it much in North Carolina, but if you believe in evolution, I think that's the way we were evolved to be. Just for an example, this slide device, okay? Let's say you go in the store, you need one of these, and they tell you, well, we have this one here. It's normally $495, but today it's on sale for $85. You think, oh, okay, yeah, all right, I'll take it. If they told you, well, normally this thing is $12, but today it's $85, there's no way on earth you would buy it, right? Now, it's the same $85 either way. That's the objective reality. The human brain doesn't see 85 as an objective reality. It compares it to the 400 or to the 12, and it decides based on, you know, an interesting phenomenon, because I'm a dermatologist so interested in the skin, is this idea of the veins on my skin. And I don't know if you've ever noticed the veins are blue. Have y'all never noticed the veins are blue? Paid any attention to that? Y'all know why the veins are blue, right? Well, why is it? Yeah, the deoxygenated hemoglobin. Now, here's the thing. I give blood at the Red Cross every 2 months. Every time they stick a needle in my vein and pull the blood out, red stuff comes out of my arm. All right? I look around the room. There's red stuff coming out of everybody's arm. The oxygenated hemoglobin is not blue. So why is the vein blue? A little experiment here. I asked the computer, what is the color of the vein? By the way, I should get the Nobel Prize in medicine for this. All right? Why is the vein blue? I asked the computer, measure the color of that vein and print the color of that vein on a neutral gray background for me. All right? The computer says it's this color, not blue. It's sort of a shade of pink. Yeah? Y'all see a shade of pink on that gray background? Then I asked the computer, what's the color of the surrounding skin? And then change the background to that color. When I do, the line changes color. It doesn't show up so well on this slide. All right? In any case, the line is not blue. The vein is not blue. It's pink, but the brain says it's pink. I'm sorry, the brain says it's blue because it's bluer than the surrounding skin. If you go home, take 2 pieces of duct tape, put them on either side of the vein, cover up the surrounding skin, you'll see that it's actually pink. Okay? Now, if you take that duct tape off, before you take the duct tape off, you will know that it's not blue. All right? you will understand why it appears blue. You understand how this all works, that it's an illusion. But when you take the duct tape off and look at it, it will still look blue. You take away the context, and it is still blue, even though you know it's not blue, because you cannot control the power of context on your thinking, all right? When we saw data today from the CDC, all right, the presenter looked at that study and sees one thing. I, being a physician trained in dermatology, look at the same data and I see something totally different, all right? And we cannot control the difference in how we see. We probably couldn't even talk to each other about the differences because one person's context is different from another person's context. And when that happens, they're looking at the same thing and they see totally different things. It's really fascinating. I think it creates a lot of the conflict we see in the world today. I teach dermatologists about this. I tell them, this is not the context that you want to present to a patient at your check-in window, okay? If this is the context, if you've got windows and blinds that you can close, that will communicate to patients. You don't care about them. You might shut them out at any minute. You know, you don't want to have a messy office that communicates that we don't care about the quality of our work. And you certainly don't want to have 3 signs that say, we care about your money, we care about your money, and we care about your money. Because it doesn't matter how caring you are, you know, as a dermatologist, if you present this, if this is the context that you're presenting yourself in, you're going to look bad. I love this office. I visited this office. This, by the way, was my office, all right, at the Academic Medical Center before we moved. The Visa and MasterCard signs, sadly, were just outside of the frame of the photo. I didn't capture them. This is another practice I visited. Man, look how different this is. It's open, right? They can't shut you out. They're smiling at you. See those paper charts? They are meticulously well organized. This office may have electronic medical records. They need to leave those charts there to communicate to people, you know, that they are well organized, neat people, and they've got signs up that say, we appreciate your trust and confidence. I think that's the kind of perception you want to give to a physician when you first meet with them. If you give them this, if you give them my office, if you give them the human equivalent of this, you know, you're starting yourself off on the wrong foot. And you can control that. You know, you can't control the doctor, but you can certainly control a lot of about yourself that will affect the doctor's perception. And I think this hit me so clearly when, in preparation for this meeting, I read Dr. Pronounce it for me, Savely's book, the Morgellons book that's sitting out there. Yeah, I did immediately, as soon as I knew I was talking, I was like, I'm downloading the book. I got to know, I have to understand what's going on. And in the book, Dr. Savely had tremendous insightful comments about what you don't want to say to a physician to predispose them to think that you're delusional. Okay. So here's some other practical advice. Just be prepared, educate yourself. There's some really good online resources. I trust.gov. The People's Pharmacy, they're awesome. I don't know if they've ever addressed Morgellons disease. About your appointment time. Choose an appointment time when you're not busy. Preferably after you've eaten, because I like being a speaker right after a break, because people after a break, they've got time for me, maybe they ate something, they're comfortable. If you're, the Israelis did a study. They looked at court cases and found that if you catch the judge, if your case is picked right before lunch, you have no hope. All right? Because they're hungry, they want to get to lunch, they're not going to listen to anything, it's hopeless. First thing in the morning, when they get there and they're fresh, you know, they're better off. So you want to be fresh and well fed. Wouldn't hurt to, you know, catch the doctor when they're fresh and well fed, and not, you know, when they're hungry and tired. Humans, we humans just have a limited capacity, and we get drained over the course of time. So pick a time when you're not drained, and ideally, you may be able to control the time at which you see the doctor. You may want the first appointment, how soon can you see me, doc? And they may say, well, we can see at the end of the day. It's like, no, that's okay. I don't want the end of the day. Maybe I want, can you give me first thing in the morning, even if I have to wait a little longer. When you get to the office, expect to be greeted warmly and respectfully. And if you aren't, don't assume that that's the way the office always is, because you may be, if 100 people, if 99% of the time they greet the patients warmly, 1 in 100 doesn't get greeted warmly, and that 1 in 100 thinks this office is bad, but the rest of the time they're actually quite good. You don't have a question, do you? You're just stretching, right? Yeah, I need to look at my watch again. Yeah, I got 4 minutes. And then we have question and answer time. Yeah, good. Thank you for the reminder. I like to be on time for patients. All right. So be upbeat. And then I think, bring a book or a tablet because you may have to wait. Some doctors keep patients waiting a long time. Are those bad doctors? The doctors I know who routinely keep people waiting, there's one in particular I think of in rheumatology who takes care of my psoriasis patients' joints. And he'll spend as much time as a patient needs with them. And invariably, he gets behind. And he gets behind because he's so caring. He cannot cut himself off from people. You want to see him. I don't care if you have to wait. You want to see him. So if the doctor keeps you waiting, it may be because he's an uncaring jerk. I think it's possible that if he keeps you waiting once, it may be because he spent time with a Morgellons patient early that morning, all right? On the other hand, if he keeps you waiting a long time every time, it could be that he spends a lot of time with all his patients. I teach doctors, don't keep people waiting, but from your perspective, just because they keep you waiting, don't assume it's a bad doctor. Be organized. The more organized you are, the more will help the physician, and that will keep things going. You'll get everything. If you have a list of problems, put the important ones at the top. Make sure you get your important problems addressed. Take notes or have somebody do it for you because it's hard to remember everything a doctor says. And when you want to do things, do it in a positive, upbeat way every time. And in the interest of time, let me get to follow-up tests. Don't rely on your doctor to tell you the result. Don't ever assume that if you don't get a call, the test was negative. People have died of melanoma because of that. Okay, so make sure that you get the results of your tests. Be honest and open about your treatment. Just be totally honest with your doctor. All right, totally honest, and don't switch to another doctor when things go bad. Just stick with that doctor and continue that honesty, and over time, I think things will get better. Now, if you want a second opinion, go for it. I would always encourage people to get that second opinion and to give it to me. Let me know what the other doctor said. And now, the best part of the talk is show appreciation. There's some expression about catching flies with honey, all right? You want to be positive. You want to always give positive feedback. And even if you have something, that you're not getting the help you need, say it like this: I can tell you're trying to help me, but I feel like I haven't been heard, all right? So if you start off by but just treat people the way you would want to be treated. If you do that, this is what I tell doctors. I tell doctors, listen, if a patient's unhappy, now you may know you did everything right. That doesn't matter, okay? Trust the customer. Listen, apologize for not satisfying that patient. Make sure you do things in a private place. Do everything you can reasonably. Use the golden rule. And I would just tell you to do the same thing with the doctors. Okay, so number one, it is without question your doctor's job to make sure you have a great medical experience. I'm not saying it isn't. I'm saying it is. I tell the doctors it is, all right? But you can't control them. You can only control yourself. So make sure you're perceived. Doesn't matter whether you respect the doctor or not, all right? Make sure the doctor thinks you respect them, all right? Because that will change their behavior. And I think sticking with the doctor is a good bet because really, in my experience, they're all good doctors. I know you had bad experiences with them, but that isn't representative of what they are like most of the time. So stick with them. I think you'll end up with a better result that way. And I think we're going to open up for some Q&A time. Yes. Excellent. Thank you.
Hello, is this on? Can you guys hear me? Good. So my name is Harry. If I haven't introduced myself to you or you haven't seen me before, I am from England. So if you can't understand me or I'm talking too fast, then please let me know. I'm just going to moderate this session as openly as possible. So if you just put your hands up when you have a question, I will come to you one at a time, and we'll do questions one at a time. Is that okay?
There is a basket, and I'd like to be respectful to the people
I believe the
who
basket
did take
is for
time
the
to write their
Q&A
questions.
panel session afterwards. Is that correct? Yes, that's right. So the basket is questions for all of the speakers, and that is in a separate session immediately following this one. So if I just come over here first. Just try and keep it brief. That's the only thing, so we have enough time.
Brief, no problem. Is it on? Okay, great. My name's Katie. I'm 40. I have had this 3 years.
40? You don't look 40.
And I already know what you're like, so I'm not even going to say that as a compliment. I have 3 little girls that have this. You would suggest antipsychotics for their systemic disease and for my liver lesions and everything. Would that cure my systemic infectious polyinfection? And why are you here?
You want to bring the microphone over here?
I thought you were inviting me up to come out.
No.
Can you not answer with the mic that you have?
So that's a great question. I sense your cynicism and the sarcastic tone. Yes. So you asked several questions. One is why am I here? So the presentation that I gave is on how to have a better visit with your doctor. No. Maybe you didn't understand. I did a poor job presenting. If I left you with the sense that this was not about how to have a better interaction with your doctor in general. I think I would be happy to spend some more time with you if you're really interested. If you want to know from me I think you could have a better experience with your doctor, I'd be happy to spend time because it's clear to me I did not get my point across to you, and I can understand. I hope I made it clear to most folks at the beginning that I feel the suffering that people have. All right, my patients with psoriasis are suffering, and people with Morgellons are suffering. No question about it. As far as the lesions on your liver and your child's disease, I have not examined them, so no. There is no way on earth I could possibly recommend any particular therapy to them at all.
I could have a better visit with my 40 doctors that I've seen if you weren't going and teaching dermatologists that people just need antipsychotics for this.
I'm glad we got that off our chest. There are clearly people who need antipsychotics. Okay? There clearly are. Maybe you've met one who comes and says, I have a serpent in my abdomen, and it's releasing worms into my skin. And those people, they need an antipsychotic. Antibiotics or antipsychotics? Yeah.
Sorry, sir. Could you just wait a second so I can get the mic to you?
Not of this group of people. We appreciate you and what you're doing. Say it. I do. I appreciate what you're doing and what you're saying.
You
Because
learned the
you're
lesson.
because
so
you're
you
trying to
start
teach-
by saying, I appreciate.
I do
That's good.
appreciate you.
Yeah.
Because you're trying very hard to give us some good information. The problem is with this particular audience, the experience overall with physicians has been so negative, with so little care in doctors, that most people are completely skeptical of why you're here. Plus, nobody much in this room is going to agree with you that there aren't any bad doctors. And I was a medical practitioner in the trenches for 28 years. I didn't run across very many of them, but I have run across a few. Bad doctors. There are such a thing. There are bad dermatologists as well. This
Yeah.
is an observation from somebody else and a different opinion.
Yeah. So that's interesting. So you saw many doctors, and some small percentage were bad doctors. So the idea that all of us just happen to find the bad doctor seems very unlikely to me. Sounds like the bad experience with a good doctor. Yes. Yes, that's exactly right. And so the purpose of this presentation is you cannot change that doctor's DNA. You can control your own behavior that can affect how they perceive you. Yes, good point. Thank
Okay,
you.
we have a lot of questions, so I'm just going to... I already said that
I was totally covered in lesions. My whole front of my legs were covered. They were oozing. Had been in Florida with my parents and with my mother, and I went to the family dermatologist with my brother and my mother, who is 93 years old. And I saw him on my for 19 days. I went and saw the dermatologist on my third visit. He never took blood. He did not take a culture. He only looked at me and he diagnosed me DOP, put me on antipsychotic, whatever those drugs are, and referred me to the head dean of the School of Dermatology in the University of Miami to be observed and studied. And you're telling me, is this a good doctor
Yes, I'm telling you, that's a good doctor.
that misdiagnosed me with this disease?
I've misdiagnosed people. I mean, I'm not a perfect. I'm not perfect.
He wanted to put me into the crack in the crack
I'm telling
house.
you that doctor is probably somebody who, you had a terrible experience with him. But it wouldn't surprise me if you're the one, and most of the time he probably did okay. And if you had stuck with him, you might have had a better experience. No, I may not get it.
The whole issue is disbelief in this is a real illness. That's across the board. Most doctors do not believe this is anything other than a delusional disorder. You may or may not believe that, but if you've paid attention to the science here today, you would believe it's real.
Dr. Smith, I'm
sorry.
sorry you're not more passionate about this.
I'm sorry, you're not better informed.
I apologize if I gave the impression that a pill or an antipsychotic is going to cure everything. What I said was,
You were up here telling us it's our fault. If you want to have a better experience with your doctor, go after lunch. Talk to him nicely. Be patient. Let me tell you something, pal. I've been patient. I've gone before and after lunch. I've had my doctor in Georgia say, you can't have Lyme disease or Morgellons because you live in Georgia. You have all the Lyme symptoms. You've got a 5 Western blot. You've got Lyme lesions on your brain. But hey, you live in Georgia. So who's the problem? Me? Okay. You're up there telling us it's our fault we're having a bad experience. I've had an emergency room doctor not come within 10 feet of me. How good of an experience is that, buddy?
all right, let me answer the question.
It was my fault, right? Did you know that?
Sorry, could you just let
Is
him
it okay if I
respond
go
for a
ahead and
second?
try to answer the question? Well, yeah, if you want to go on, feel free. I'm willing to
Sure.
wait.
You're aware that around the early 2000s, right? The NPA, National Pediculosis Association started getting a whole bunch of calls, right, from all these different people who felt like they had scabies or something because they had stuff crawling all over them, right? All of these pest control companies, these 1-800 numbers, were getting the same calls. The CDC chose not to take action. The NPA contacted them again. The CDC chose not to take action again. So was this some sort of random, nationwide, delusional thing that happened all at once? Everybody started reporting, and it was just because they were being shitty to their doctors. I'm an asshole patient, and so I'm itchy, and I'm breaking out, and I'm really sick, but hey, it's my fault. I'm a dick.
Well, I apologize if I didn't make clear that I think it's doctors' responsibility to make sure patients have a good visit. But that said, well, I'm not sure that's what I do with my patients, but that said, if a patient came into my office and presented themselves that way that we just saw, it would make it difficult for me to fully meet their needs. Now, it's my responsibility to make the right diagnosis, prescribe the right therapy, and make people have a good visit. You cannot control what the doctor does in that regard completely, but you can control yourself. And if you present yourself like this, as disrespectful from the get-go, I don't think there's any chance of success. If you respectful, then maybe at the next visit you could convince the doctor to take a closer look. By the third visit, if they realize you're friendly and caring and respectful, you find a doctor who, I'm sorry?
Sorry to interrupt. Just in the interest of fairness, I'm going to take only questions from people that put their hands up. So I have an order in my head already, just so that we don't get too distracted. I know everyone is very, very heated, and it's a slightly emotional situation.
Hi. I'm going to tell you thank you for being here.
Thank you.
I do appreciate it. And I think that I want you to realize that truly with your, what you gave us, what you told us today, you can see the reaction of all the people here. And you can tell that no, we're not cuckoo. We're not. That we are normal people that are going through something that is so hard for people to understand it, that the caring truly needs to come when that patient walks into that room. Don't say, well, it's up to you and how, because these people have been through everything. And let's say, for example, you have someone that comes in your room and they say to you, I have bugs that are coming out of my skin, and I got that, whatever you set up your butt, and it's doing all these worms. Well, if you were somebody that had Morgellons and you didn't understand what was wrong with you, you can't blame that patient. You can't blame that patient for how they feel. And what's sad is if you have a doctor that totally disregards that patient, what a sad thing to do. Instead of sitting there and thinking, you know what, that patient, what is she saying? Why does she feel that way? What is it? What is truly wrong? I think that maybe the doctors maybe instead of putting on the patient, let's put a little bit on the doctor. Seriously, because you can't say that you're in control. No, some of these people are hurting so bad, they may not be in control as they should be. I mean, if you have cancer and you're sick, are you in control truly? What if you're hurting? What if you wake up in the morning? What if you're in pain and you want to get up in the morning, you want to be like you were before, but you can't? And that it's not that patient's fault. It is
yes,
not. That's
we
all I
can.
want to say.
Can you and I agree that it's not the patient's fault?
So don't put it
I'm sorry.
on them.
Can you and I agree that it's not the patient's fault?
Oh, absolutely.
Can you and I agree it's the doctor's job to take care of the patient well?
Absolutely.
Excellent. I'm not talking to doctors today. Today I have no control. I can't tell you that we should only, I should go and talk to the doctor. I'm
Okay,
talking to
I'm
you
sorry,
today.
but-
And so if you go to the doctor, if you present yourself in such a way that you're going to get a bad result, and you do that over and over and over again, there's no hope.
But you just said something. You said you can't control the doctor. So you're telling us
You can't control the doctor.
I'm not saying I don't like you. I don't even know you on a personal basis at all. But from what we've heard, you say, well, you can't control the doctor, but you can control yourself. You know what? The doctor's getting paid to treat that patient. I see this the opposite way. I see this that patient should be able to control his emotions and take the time if that patient wants to talk. Listen.
We've agreed to that. We've agreed it's the doctor's job. We don't have doctors here today other than me, or maybe a few others. But we can't change them today. All we can do
So I have an order.
is make the best of a bad situation.
Yes. Excuse me. The clarification I think I would like to make is I went to doctors repeatedly in the beginning of my illness. I had various levels of skin lesions. I had one time where my eyes swelled up, pinprick sensations all through my eyes. And each of the 4 times that I initially went to the doctor, without an examination, and my mother is an RN, she was like, well, you need to bring in some samples or some evidence so that they can have something to test. And so each of the 4 times I went in with more and more evidence. I guess this wasn't enough to convince them. I need to go in with more. Each of the 4 times without doing an examination on me. And the first time he referred to it as a matchbook sample that I had brought in. I later learned that, I guess in some medical textbook somewhere, doctors are taught that if a patient brings in samples, it's referred to as a matchbook sample. And apparently a lot of doctors are taught that.
Matchbook sign.
Okay.
I'm sorry, matchbox sign.
Okay. So anyway, just the very fact that I was bringing in a sample immediately clicked in their head, oh, he's insane. And so each of the 4 times I was referred to a psychiatrist and given a prescription for, or recommendation for antipsychotics. And I would say that now that it's coming into light that I actually did have something testable in my lesions, something that I would say, yes, that was bad doctoring. I went in with evidence of an illness. They refused to look at it and gave the wrong diagnosis. And yes, while they may have been very good people, I would say that they did a very bad job as being doctors.
Yes, they did a very bad job of being a doctor that day at your visit. That does not make them a generally bad doctor, necessarily. I know you would. The whole purpose of my presentation was to get you to believe that actually the people who rate the people who gave these ratings would say, without question, this is a bad doctor, even though they're not necessarily a bad doctor, and you may be able to find a way to work with them rather than have a repeat bad experience over and over again with different doctors. Yes, if you go to the over and over again to the doctor, and they have this automatic tendency not to examine you, that's horrible. If you stick with the same doctor long enough for them to realize that you're a caring, respectful person, at some point you may be able to get them to do a thorough examination.
Hi, my name is Leo. Again, like somebody else stated over there, I want to thank you for coming here and trying to present something that to help us. I disagree with you on so many levels. One, there are bad doctors. There are bad teachers. There are bad counselors. There are bad therapists. There are people that just don't give a damn about their job, and it's got a lot to do with dollar signs, and that's about it. I've been unfortunate enough to be referred to 3 different dermatologists, and one of them wouldn't even look at my face. They stared at the floor for that whole 10 minutes that he gave me, I'm a therapist myself. So when someone looks at the floor, when I'm trying to tell him that I have all this stuff going on with me and doesn't have an answer except for maybe a topical thing, because I didn't get angry with this guy, so he didn't say, why don't you pop this pill, okay? So he didn't say I was psychotic. But others have said when I've really reached my limit, the lady said it over there perfectly. I mean, I'm feeling like this, and I need to be able to go to a doctor or somebody that can turn around and say, whoa, take some time. I mean, and is there some way that you can take a little look at the stuff on my head? One of the woman dermatologists checked my body for all the stuff that was hanging there, all the stuff that's there. And then she went to wash her hands. I says, well, you didn't check my head. And she comes over and she says, head and shoulders. Head and shoulders for the nodules on my head, you know. So I don't have a lot of faith in doctors that treat me like that. They're supposed to treat me like I'm a human being. If I have ailments, then what they're supposed to do is try to help me. If they don't have the answers, don't play the game that like it's something else, because if you don't know. A lot of doctors don't know about Morgellons, so they don't even want to go there. They can't go to a book and say, okay, diagnosis, treatment, and be superstars. They look at it and they go, oh, maybe you need psychological help. Maybe you need this, maybe you need that. If you don't know it, you don't know it. You know, I mean, be honest with the patient. It's part of the thing. Be honest with the patient. You know, don't give them a pill. Don't say you're psychotic. I got a psychologist or a psychiatrist that you can go visit. Maybe they can help you with your anger issues. I'm not angry. I'm frustrated. I'm depressed, and I'm hurting. That's why I'm here. You know, and that's all I got to say.
Excellent. I think those are good things to make clear to the doctor. I think you want to make clear that you're angry, you're depressed, and you would respect their help. And if they're not a believer in Morgellons, that's okay. You'll move on.
I didn't mention Morgellons, and I did make that clear. You know, my third dermatologist, I wasn't happy with it.
Yeah, you have every reason to be upset. Suffering will, absolutely.
Thank you very much for that
What I'm
comment.
suggesting people do is going to be extremely difficult because you're suffering, you feel disrespected. It's hard to come off as being friendly and caring in that situation.
Okay, we have a question over here. I'm just going to try and get through them as quickly as possible because I know there's a lot of people waiting.
I'm not new to this. I've been through this since 1994. My fingers began to bleed after working with plants. Gashes, they bled for 11 years before I met Ginger Savely, who diagnosed it correctly. At least 40 doctors examined me, and I'm not a doctor hopper. I was traveling from British Columbia to my home in Texas back and forth because I couldn't stand the winter. Saw a doctor in almost every town. Nobody could stop the bleeding, but they did send me to psychiatrists. Okay, finally I'm going to go to one. They said it, I'm going. I went to the best psychopharmacologist that there is. He has connected the brain with fibromyalgia, and I went to him. He said, you don't have anything wrong with your brain. You need a better dermatologist. 11 years I never found one that didn't throw me out. I had the matchbox experience because I didn't know about matchboxes. I took my samples in and he said, oh, excuse me, I just dropped them in the carpet. He's still practicing real close to here, but now have been cured, and I want everybody to know you can get cured. Ginger treated me with antibiotics, correct ones, and antiparasitics and everything else in the world, but not antipsychotics. For 10 years, from 2005 to 2015. The last lesion went away in 2015. So have hope, stick with your good doctor, and you can get well and you will win, but you must stick with a doctor who knows what they're doing. And dermatologists are not qualified to send you to a psychiatrist. They're not trained for that.
Thank you very much.
First of all, I want to appreciate what you were attempting to do. You were attempting to tell us how to go to a doctor effectively. And that's for most people with very non-invasive things like what these folks have. I've got a question. How many of you guys have had a bad experience with a dermatologist? Just a few haven't. So this might have been something you should have considered when you did this, which was a nice presentation. Look, I don't have anything against it, is to conduct some survey on your audience and see what they really needed to hear. Thank you.
Do you want to respond to that?
I appreciate the heartfelt comments. I probably didn't do a good enough job. I thought I did. I started my presentation by asking, has anybody here had a less than satisfactory visit with the doctor? So, and pretty much everybody said so, as certainly all of us would have expected.
Well, I would like to thank you for taking the wrath for every dermatologist who's not had a satisfactory outcome. I hope you will all consider that the presentation of what he said, I have told some of you some of the same principles that he did. And I want to tell you about one patient in Oklahoma who went into the doctor raging about Morgellons on his shins. It didn't go well. I said, tone it down. Don't bring up the M word. Go in, tell him what your symptoms are, and let the doctor then figure out what to do. I had a suspicion this person did not have Morgellons. Well, went back to the doctor. This time the doctor actually did look at the legs because they weren't arguing right from the beginning. You know what was wrong with this person? Rash on the front of the shins. That ring any bells with anyone? He was hyperthyroidic, big time. It's called pretibial myxedema. But because the doctor was so put off by this, it just freaked him out, basically. They didn't have any kind of a conversation. We teach our medical students, we have a class where we actually discuss some of these things that Dr. Feldman was saying, that when he communicates with physicians, we do that with students. Our students also do this very same thing that Dr. Feldman was trying to communicate with to a different population, those with neurological defects, stroke, auto accidents, born with cerebral palsy. They do not communicate very effectively, a lot of them, because they have trouble speaking. So the students go in, and we spent, actually, it was a 2-hour small workshop and then one-on-one with people to help them figure out how to effectively communicate, because the doctor should know that they're going to have trouble communicating, but they don't always do it. So then the next thing that is necessary is to try and find a way for the patient to be able to communicate. And so I just hope you will keep that in mind, that the way that, yes, and he has said multiple times, it is the doctor's responsibility. But also, because when you say, how many of you have had a bad experience with a doctor? I don't have Morgellons, but I've had a bad experience with a doctor. But it turned out there was some lack of communication there between the doctor and me. The doctor wanted to order me $4,000 worth of tests for something that made no sense whatsoever. And after we had a conversation, she said, okay, you can skip it. So communication is still important. And by the way, there are multiple studies. The worst doctor-patient relationship initially, if given time, tends to get better. Because you're absolutely not going to go to a doctor after doctor and probably experience that much of a difference from what you've been having. But there are a number of studies that show that with even other controversial things, I mean, for some doctors, fibromyalgia is still controversial. Or Lyme disease, or, go through a bunch of them. they tend to eventually come to some sort of a relationship where the doctor can try to do something. Now, it may not be the thing that they want necessarily, but they get a little something that they wouldn't have gotten if they would have just immediately gone to another doctor. So I just wanted to say that there is a great deal of suffering within the population that has Morgellons disease, and they're venting on you, and thank you for being very gracious about accepting the venting.
Hi, I wanted to thank you for being here as well, and I understand where you're coming from, what your point is, and that we need to keep an open mind, all of us, all of us, to keep an open mind while suffering with this dilemma, this disease, on your end, our end, and part of what I believe to be the problem is that doctors are good when they have the information they need to refer to be able to treat when it's presented to them. If they don't have the information, they don't know how to treat it. My doctor had never heard of Morgellons, no idea what to do. I went to 7 doctors, and they all said the same as everyone else. Everyone's experience is the same, where doctors don't have the information. When you do look it up, it says delusional. The first thing they're going to do is discard it right away. Delusional, no going further. Why bother? So it's not just, it's a lack of knowledge on the doctor's part as well as patients getting it across what's wrong with them. It's a dual thing, and to keep open-minded on finding ways to get through all this is probably the best way to handle it, in my opinion.
Thank you.
Thank you.
I had a very degrading, hurtful experience about a year ago. I went to an infectious disease doctor, didn't tell him anything about the Morgellons or possibly the Lyme. I brought some oils in, rubbed them on my skin. He saw fibers and like peppers and stuff coming out of my skin. I asked him, I said, "Doctor, have you ever seen anything like this before?" And he said, "Yes, I have." And I'm like, "Well, what did you do?" He wouldn't answer me. And this was an infectious disease doctor. I mean, seeing stuff coming out of my skin, and he still wouldn't do anything. And that's to me, that's not even, humane. We just want to be treated with respect, and when a doctor does see something like this, it's obvious. I didn't mention the word Morgellons, nothing. And from that day on, I was very stunned. I'm like in disbelief still at this day. So, what do you do when that happens?
So I think what this lady and a lot of people in this room have expressed is the fact that your presentation is very good if you have psoriasis or if you have some sort of run-of-the-mill condition. If you have a condition where you walk into a doctor's surgery and the minute you tell them the wrong word or you give even the slightest impression of being delusional, they have already made up their mind about you. How do you strategize in that sense? It doesn't really matter, or at least this is my impression, it doesn't matter to a lot of people here how caring you are because they've already made up their mind. What practical advice could you offer patients in trying to keep their doctors open-minded? I think that seems to be a general theme emerging.
Are you asking me?
Yes.
Yeah, I think that you have a choice. You can go on to another doctor and have the same experience over and over again, or you can realize that this doctor, your experience with that doctor was terrible, but that they're not a terrible doctor, and that you have an opportunity to either have a terrible experience with with good doctors over and over again, or you can have that terrible first experience and maybe by the third or fourth or fifth experience with that same doctor, begin to work together.
People, there are two resources that will help with this. Dr. Ginger Savely's book, which is for sale, has some information on how to communicate with your doctor successfully. And number two, on the Morgellons website, the CEHF website, there's an article written by this Dr. Greg Smith. He wrote it so long ago he'd forgotten he'd written it because I talked to him last night. And it is masterful, but if I'm not mistaken, I think he was a Morgellons patient at one point. And so he knows what it's like from the inside, and he has written the very best article of all about how to have a positive experience with your dermatologist. I recommend you take a look at his article and at what Dr. Ginger Savely has. And then on Medscape, they published Dr. Marianne Middlevine's landmark paper, and a couple of months later, it was refuted by, guess what, a sociologist out in Southern California who has spent his entire career writing on the history of psychiatry, and he tried to refute that paper. And we wrote and asked them to retract that paper. Medscape wouldn't retract it. You know why? Medscape does not have a peer review process. It's run by the pharmaceutical company. They let that paper stand, and I had my husband, well, these nurses wrote the article, and I helped, and I had my husband send it from his .edu address from Professor Noggle to Professor so-and-so, asking him to retract the paper. Did no good at all. So Medscape even allowed this to happen because they are run by the pharmaceuticals, and they do not have peer-reviewed. They masquerade as a free medical journal. Keep in mind, they're unreliable because they do not have an editorial review process.
Thank you. I had a question from over here.
That's not my entire, I'm not entirely sure that that would be my perception of Medscape. It's not the New England Journal of Medicine, but I think they try to do a good job providing good medical information. Yeah. So that's a nice example. Most of the time they do an excellent job. So they're not a bad organization. They got it wrong this time. Let's work with them. Yes, that's a nice parallel.
Dr. Feldman.
Yes, sir.
My name is Carsten Nicholas, and I'm from Germany. I'm also a physician as you. And what I've noticed is that you have followed the whole day. You have heard a lot of basic research, which had been done here in US and which is actually running in Europe as well. And you have also heard about the links to animals like cows, digital bovine dermatitis or Mortellaro disease. You've heard about connection maybe to dogs with Morgellons disease. And would you also treat dogs or cows with antipsychotic medication?
Did you want to respond to that question, or?
I don't really know that he was looking for a response to that question, but yes, if a dog were psychotic, you know, if I were a veterinarian, which I'm not, I guess, you know, I don't know veterinary medicine, but if a dog, how would you know if a dog were psychotic? I don't know. If it started biting other people left and right and it started just acting totally out of its, you know, ordinary for itself, maybe there is a time that a dog is psychotic. I don't know.
I mean, just in the interest of fairness, I want to give you an opportunity to perhaps defend your use of antipsychotics. I get this is another theme. That obviously
I don't think maybe I'm mistaken, but I don't think anybody here would disagree with the idea that if you did have somebody who truly had delusions of parasitosis, they should get an antipsychotic. Oh, well, I'm not talking about, I haven't diagnosed anybody in this room, so, I mean, I'm not, Where's, you want to,
Yeah. So the question was essentially if you're not a delusional, if you have a diagnosis of Morgellons, and I came into your dermatology clinic.
Well, again, I don't know what a diagnosis of Morgellons means. That's a word that some people use it, all kinds of people might use that word. Somebody who is truly, that we would all agree had delusions of parasitosis might come to my office using that word. But I'll be around this afternoon. If anybody wants me to examine something and discuss, I'd be happy to do it.
But in your head, is there any distinction, or could there hypothetically be any distinction between a person that has delusions of parasitosis and a person that has a separate disease entity called Morgellons?
Gosh, yes. Yeah, there are people who are delusional and there are people who are not delusional. Absolutely.
Earlier, I spoke to you about the doctor that had found fibers of unknown origin in 2 punch biopsies in me, and I told you that she told me that I was implanting them myself. But you also said we should stick with the doctor. I went to her for almost a year, and I was a very compliant patient. I was very polite. I let her do every test in the book on me, and I was diagnosed with about 7 or 8 different things. If you look at those 7 or 8 different things, they're all symptoms of Lyme disease. But she couldn't put, 1 through 8 together and come up with a diagnosis. And after she told me, that I was implanting these fibers myself, she told me to go to a psychiatrist. Should I have gone back to her?
Should you? Well, I don't know. It's maybe not. Hard to say. Would I have gone back to her? God, it's such a hard thing. It's hard to imagine the situation that you were in and all your particular symptoms. I'd have to think about it. I don't have an easy answer to that.
I want to thank Dr. Feldman for being here.
You're kind.
You're very brave, and I think it's just wonderful. I like
the only thing that I was worried about was that this is Texas,
Right, yeah. So you're probably wearing Kevlar under that suit jacket. Right. No, it's good to open the communication. It's apparent that we don't agree with a lot of things that you say, but I do want to make a point about that as medical providers in any specialty, nurses, doctors, I don't care what specialty you're in, your level of care cannot be dependent upon the patient's personality or their mindset or their psychosis
that
or
it shouldn't
whatever.
be, or that it
should
can't
never
be.
be. It can't
Because
be.
here's the thing.
Crazy people get sick and sick people get crazy.
Absolutely. But if you look at your wrist still looks blue, the vein will still look blue. You cannot control the effect that context has on you. So even though we know it shouldn't affect us, we're human. People will be affected.
Just because we're running out of time, I'm just going to take 3 more questions. So I've got one over there, I've got one at the back, and then one at the front over here. So sorry to everyone that didn't get a chance to ask a question. I was trying to be as fair as possible, but we have overrun quite significantly.
Hello, I'm Dr. Ebony Cornish. I'm a physician as well. And, I can admit that I used to be a bad doctor. I'm an Ivy League trained doctor, really great in my field. And before I was introduced to, the world of Lyme and Morgellons and all these other diagnoses that I didn't quite understand, and I would see a lot of patients with nebulous symptoms of multiple etiology. First and foremost, I only have 15 minutes initially when I started in primary care to see the patient. And, secondly, sometimes as doctors, we lack humility to say we just don't know. And I think that's the first step. And when it comes to being bad versus good, is having that humility to say we don't know and also to say we're sorry. And on behalf of bad doctors, I hope I'm not one now. I have a lot of patients here, tell me. You know, I think it's important. And even when it comes to your frustrations and your anger, we understand you. And there's still a lot that we need to learn about this disease and others. Just be patient with us. As doctors, we don't have all the answers, and we're trying to learn. And your dermatologist who may have shut you out or closed the door, they didn't have all the answers. And that's why we have to continue to teach and learn and have more physicians who we welcome into this community. So when we have other MDs and health professionals who are coming and opening up to us, no matter if we disagree or not, we have to listen and we have to be fair. And we have to remember we're all human and we all make mistakes. That's all I want to say.
Thank you very much.
Thank you. I wanted to say I have a unique, different experience just based on my growing up. I'm a native of in Florida, in my hometown. I've lived there. I'm 72 years old now, and I'm still there. And I've been going to the same general practitioner for 40 years, and I do make the choice of trying to be the last patient of the day. He's known me for 40 years. He knows me. I'm not insane. He knows me. I'm a pretty level-headed guy. So I was explaining that my wife and she has a more severe case than I do, but I was explaining it to him, and he listened, and he believed me. And so he's been willing to take the advice of people like Dr. Cornish and others who recommend a regimen, and he's been willing to prescribe the medicines. My wife had a terrible experience. Couple different doctors, one from the Mayo Clinic and one an internist in North Carolina, and they treated her like she was a 5-year-old, and she explained her symptoms. I have a older brother who's a PhD in physics, and I called him and I was telling him about seeing filaments come out of my wife's arm and this and that, and I said it's Morgellons. And he's been a, PhD for many, many years. And while I was on the phone, he looked up on Wikipedia. He says it's a psychological disease. And I said, well, my brother, I know it's not because I'm living it and my wife is living it. But I feel unfortunate for many of you, like my wife. She went to a doctor who shared office space with my physician. And she finally admitted, I don't know what you have, I don't know how to help you. But if you have to move from doctor to doctor to doctor, you start out from scratch, and a lot of times they don't believe you. I asked my longtime physician, I said, well, I went to the dermatologist you recommended, I've been going to her for 10 years, and I pointed out some things on me, and she said, well, I don't know what that is, I don't know what that is. And I tried to explain some about Morgellons. My doctor said, well, every doctor knows how to treat 200 symptoms. And when it doesn't fall into that 200 range, they don't know what they're doing. So I understand, because of my wife's experience too, that if you go to physician to physician to physician, and I think that's why a lot of us are staying for Monday to try and get the CDC through government, through politicians, to start recognizing it is a real disease, and so be taught at medical school, it be studied, and hopefully we'll all have successful outcomes.
Thank you very much.
Yeah. Thank you for those insightful comments. Let me just add that in my clinic, the last appointment of the day is a good one, because then I could spend hours with you. I'm not keeping anybody else waiting. And, if I spend a long time with one patient, then there's other patients on the schedule. But at the last visit of the day, for somebody like me who doesn't mind keeping my wife waiting, the last appointment of the day is a good one. I don't know if most doctors are as nerdy as I am about home life, but if you're dealing with a doctor whose home life is not important, the last visit of the day can be excellent.
Okay, we just have one final question, and I'm very sorry to everyone that didn't get to ask a question, but you are hanging around a little bit, so if you want to corner Dr. Feldman afterwards...
Yeah, we should pick a corner, actually, yeah.
I'm sure he'll have his back to the wall.
Hello, Dr. Feldman. I am Ginger Savely, the one with the unpronounceable last name who wrote the book out there. First of all, thank you very much for coming. I really do appreciate everything you have to say, and I do feel that you are a doctor who does have a lot of heart and really want to do the best for your patients. I also understood the basic premise of what you were talking about today. However, I couldn't help but think of a cartoon I had seen once in the New Yorker where it showed the nurse speaking to the patient and said, please go easy on the doctor today and don't complain too much because he has a headache. You know, and it's like when people come to the doctor, true, we are all humans and we can all get defensive and we all have a tendency to maybe sometimes take things the wrong way. And so from your point of view, you're telling people, hey, you know, don't be too aggressive or too nasty to your doctor because you'll get a better outcome. And I know I've given a lot of that advice in my book too, not about being nasty per se, but about how you present your symptoms. I think that's very important. It's all human nature, you know, the way we take this. However, when somebody comes to the doctor who's had such a devastating illness that has not been understood, they're understandably in a condition that they are very weakened, they are very upset, they're in a position where they need the care and the compassion. So if either party is the one that's going to have to step up and really understand and be compassionate, that job should not fall upon the patient, as I hear you suggesting today. Because I tell you what, I understand your point all about, you know, getting the best out of your doctor's visit. But, you know, when you're in that predicament, I think what we healthcare practitioners need to do, and I've been taking care of Morgellons disease patients for 14 years now, and I dare say I've seen more than anybody else in the world. And the most important thing for us, the healthcare provider, is for us to take that angry, hostile patient and turn that around so that they understand we're on their side. And when we do that, that's when we start to have a therapeutic relationship. So it's not in the hands of the patient to come to us, you know, be good to your doctor and you'll get a better outcome. It's more, you know what, we as the healthcare provider look at this patient, they're frustrated, they're angry, and by golly say, you know what, you have a right to feel that way. I would feel that way too if I were you. You know, and really let them understand that they've been in an awful position. You know,
Yeah,
that's our job.
Excellent point. That's true and irrelevant. All right? It's true and irrelevant today because you and I are not in front of an audience of doctors. If you and I were in front of an audience of doctors, yes, that's what we should be telling them. These slides were very easy for me to make because I talk to doctors about this stuff all the time and I tell them exactly that. But we're not going to get anywhere, here by saying that it's the doctor's job. It is the doctor's job.
About half of us here are healthcare
But we can only
providers.
change ourselves.
Yeah, a lot of us here.
Well, if the doctors and nurses are here, let me be clear. If I wasn't clear when I said, it's your job, I don't think I could be any clearer than that. It's your job. I'm a test tube nerdy scientist. I don't come across as empathetic. It's my job to make myself come across as empathetic. You're absolutely right. But here today, we have to stress what's in your book for the patients, how to present yourself to the doctor. That's our goal today with this group.
Okay, thank you very much. I'd just like to ask everyone in this room, even if you disagreed with every single word that man said, to give him a round of applause, because he didn't have to come, and he's come and taken a lot of stick from people. So thank you very much, Dr. Feldman.